I'm thrilled to have Dr. Claire Hayes with us here today. She's a clinical psychologist and she's the clinical psychologist with Aware as well. And some of you may know Aware as an organization. It's a national organization that works with people with depression and bipolar disorder. And it also works with the person themselves, but also maybe their families if they need support. So it's great to have Claire talking on this topic because she regularly would meet people who are struggling, and she knows about this area of work. So we're absolutely delighted to welcome Claire, and I'll pass you over to Claire now.
I'm delighted to be here, and thank you, Margaret, for inviting me to talk with the students of NALA. Actually, this is a very kind introduction, but my interest in supporting the work that you do goes back to 1986, probably even 1983, when I started to train to be a primary school teacher. I taught from 1986 to 1988. I had senior infants for a year, I had fourth class for a year, and then I started doing psychology to be a better teacher because I realized that I wasn't able to support children who worried enough. And children worried because they thought they weren't good enough, whether that was they weren't good enough in their schoolwork, or they weren't good enough in sport, or they weren't good enough in their families. And what I found was the more I reassured them and told them, you're great, you're fine, don't worry, it doesn't matter, it didn't work. And then my psychology course followed. I did another one, and then another one, and then another one. And along the way, I continued to teach when I was away from college. So I worked as a remedial teacher or a learning support teacher. And what I found was that children who were coming with reading difficulties, a lot of them considered themselves stupid in some way. And I really related to that because when I was in primary school and secondary school, most of my teachers gave out to me for asking what they said were stupid questions. And I'm not good at sport. So I was used to stand on the line hoping I would be chosen second last because I didn't want to be picked last again. Most of the time I was picked last. So while I was quick enough to learn to read, I was really slow in running. So nobody wanted me on their team. So I use my experience as a child to help me in my work. And lots of times when I'm working with children and with adults who have some kind of a learning difficulty or a reading difficulty, they're actually very bright. And it might be that they don't have a particular reason for not being able to read fluently, except that they think they're not good enough. And then some people obviously have something like dyslexia, which are good words. So I'm delighted to be here today to talk to you about well-being. So if we just think of those two words, well-being. Well, we know we are human beings. Every single one of us is a human being. But are we a well human being? So right now, just check in with yourself. Physically, do you feel well? Are you tired? Are you a bit hassled, stressed, worried, concerned? Do you have something going on that affects your wellness? You might have a headache. You might know someone who's going through a treatment for cancer, and you might be worried about that. So when we talk about well-being, for me, it's looking at everything. It's our physical health and what's called our mental health. And for me, there really is no difference. It's health. It's, are we well as a human being? And lots of things can affect how we are well. Some of them we have no control over. We've just come through, hopefully we're almost at the end, of really severe restrictions to keep us well and to keep other people well from COVID-19. But those restrictions caused lots of us to feel scared, to feel worried for ourselves, but maybe more so for people we care about, we want to protect. So part of keeping well was to distance ourselves from others, to wash our hands regularly, to wear masks. But even though that made us physically well, it might have affected how we felt in ourselves. I know certainly I felt worried lots of times over the last 2 years. I felt worried if I met someone social distancing, but they coughed. So then I started to have thoughts like, could I have picked up their cold? Could they have had COVID-19? Could I get it? Could I get sick? Could I give it to someone else? And then I might have felt worried, anxious, upset in myself. And then in terms of my actions, I might have withdrawn a little bit. I might have kept away from people. I might have washed my hands even more. And some of that was very important to do when there was a pandemic. But if we keep washing our hands over and over and over and over, well, that's actually not healthy. And that doesn't help us become a well-being. So my way of working and helping people around this is to separate out things into 3 different areas. What we think, so I use a triangle, an upside down triangle. What we think, how we feel, and what we do. So a lot of us notice. We notice how we're feeling. We notice how we think other people are feeling. We notice what other people are doing. We might think we're not good enough. We might think we've made a mistake. We might think we're stupid. We might think we're not going to be able to do whatever it is. And then the other top part of the triangle, so we thoughts, feelings, and actions. So we might feel upset, feel scared, feel worried. And then that might lead us to act in ways that we want to feel better. So we might avoid, we might stay away from people. We might eat too much or too little. Some people might think alcohol is going to make them feel better. And we know there are lots and lots of problems to do with alcohol. So we cannot really stop a lot of the outside stuff coming at us. We have no control over whether the world has COVID-19 or not. People living in countries where there are volcanoes and earthquakes, we've no control over stuff like that. Some of what we can manage, some of what comes at us, we do have control. But people can be deliberately unkind, or they might not mean to be unkind. And if I was beside you in person, I would throw a tissue at somebody. And if I threw it at Margaret, she might be surprised. She might feel surprised. And she might catch it, or she might let it drop. And I would say, Margaret, what did I just do? So I threw a tissue at you. What did you do? So she might say nothing. And I say, no, you didn't do nothing. And she might say, well, I caught it and I held it. And then I would say, what else could you have done? Well, she could have let it go. She could have thrown it back at me. She could have put it in the bin. She could have asked me why I did it. So I would have thrown it at her. Margaret wouldn't have expected it coming, but she had choices about how she reacted. She had choices about what she did next. So the world throws things at us. Some of it is meant for us and some of it isn't. Some people might throw things that really aren't intended to hurt us. But if we're not feeling confident about whatever it is, we might get upset. So if any of us feel uncomfortable about our driving, if someone criticizes our driving, we might feel really bad. Or if we're not feeling comfortable about our spelling or our reading out loud. So if somebody asks us to repeat something, we might feel bad. We might take it personally. So a way of being well is to, first of all, acknowledge how we feel. We feel upset, we feel worried, we feel sad, feel angry, and that's okay. Secondly, and actually, let me explain a little bit more about that. If I put my hand in the fire, I'll feel pain. The action of putting my hand in the fire does not make sense, but my feeling of pain does. So a lot of the times how we feel, I think always, makes sense because of what happens and or what we're thinking or what we're doing. The second question then is, are our thoughts helpful? A lot of the thoughts we have aren't helpful. So catching, realizing how critical we are, how nasty we are to ourselves, how cruel we can be. And then the third question is checking, what do we believe? So what if somebody says we're not good enough at reading or we made a mistake? Really, that only causes us to be upset if we believe it, if we think we're not good enough, and if we believe we're not good enough. And the nice part is people believed the world was flat, and people believed the ship, the Titanic, would not sink. So just because any of us believe what we believe does not mean it's true. So then the most important thing is, what do we do? What do we actually do? Do we take things personally? Do we get upset? Do we talk to someone about it? Do we ask for help and take help? Or do we decide there's nothing we can do and then eat or drink too much or too little? So I've developed all of that into one sentence I'd like to share with you. And I've called it the ABC coping sentence. And this is my way of explaining a thing called CBT. And C is short for cognitive, which is another word for thoughts, B, behavior, what we do, and T, therapy. The ABC coping sentence. So A, it's a word called acknowledge, saying it as it is. I feel hurt. I feel upset. I feel scared. I feel worried. I feel disappointed. B, because I think I'm just not good enough, or because I think everybody else is better, or because I think I'm never going to be able to do whatever it is. And then C, what are you going to choose to do? So the first choice is a breathing exercise I've developed. So I'd like to share that with you. If you can tighten the hand you don't write with into a fist right now, your non-dominant hand. I'm right-handed, so I'm going to tighten my left hand. So breathing in, holding your breath 2, 3, and then breathing out and opening your hand. So if we do that twice more, so tighten and breathe in, hold your breath, 2, 3, and breathing out. And now once more, breathing in, holding your breath, 2, 3, and breathing out. I'd like you to do that exercise 3 more times, please. And this time, think a helpful thought, and I'll tell you what it is. So tighten, breathe in, and think, I choose to breathe slowly, hold 2, 3, and breathing out, and open your hand. Again, breathing in, I choose to breathe slowly, hold 2, 3, and breathing out. And one last time, breathing in, I choose to breathe slowly, hold 2, 3, and breathing out. You might have noticed your breathing slowing down in the second set of 3 from the first. If you did, I think that's because of the word choose. Not have to, not must, not wish I could, not like to. I choose to. Choose is a very powerful word. So A, acknowledge, I feel upset. B, because I think I made a mistake. C, but I choose to breathe slowly. Or but maybe I didn't. Or but maybe it's okay. Or I choose to keep going. I choose to ask, forget, and take support. I choose to learn from this. And we all make what we might call mistakes, and we discover ways of doing things better. Thomas Edison, who invented the light bulb, he had, I think, thousands of, in quotes, mistakes before he discovered how to do it. And when someone said to him, you're making a lot of mistakes. He said, I'm discovering ways that don't work so I can find a way that does work, or something like that. So in looking after our well-being, so we're a well human being, it's acknowledging how we feel, being kind to ourselves for how we feel. Seeing our thoughts like noise. They're just like as if we have a lot of people in our head going, not good enough, not good enough. But they're not telling us the truth. Questioning what we believe. Maybe we are good enough. Maybe we're great. And then really focusing on what we can do well. I choose to keep going. So that's a quick summary of how I work with people and how I'm really delighted and privileged to work with people to help them become and stay a well human being. So Margaret, I'll hand it over to you to see if there are any questions or if there's anything else that you'd like me to say.
Hi there, Claire. That was great. Like, it is nice to have something short like ABC. So acknowledge, believe. No, it's not believe. Because, yeah, because.
So the sentence goes, I feel, and then blank. Yeah. And then because, and then I put I think in brackets, because it's not always a thought. If I was beside you, Margaret, and I stood on your toe, you would feel pain. Not because you thought I stood on your toe, but because I actually did. But a lot of the times our thoughts cause the problem. So I feel blank, and then underneath B, because I think blank, and then C, but I choose to, whatever our choice we're making is.
Yeah, I think that's quite helpful. And also the description of, you know, the kind of how your brain can, I suppose, plant has noise as well. I would like to open it up to the floor. At the minute, there's no questions on the floor, but what I might do is unmute everybody, if that's all right. And then that way people can speak. And I suppose just ask all to unmute. We'll just keep an eye on not one person speaking the whole time. So if you have something you'd like to ask, you know, just be respectful. There's lots of other people too who might like to ask something, but we would welcome anybody who has questions for Claire.
Yeah, hi. No, I was just listening to you at the start there, and you said about the early 80s. That's when my educational journey began, and I have numeracy issues. So I was up in County Meath, and you know, you were talking about the sport and the delays and stuff like that. I actually relate to that because when I got into secondary school, you know, I was sort of like I had what was called education exclusion, we'll call it that, and it's only now that I'm beginning to realize that that was a deeply traumatic experience. You know, because all my issues, as I said, were numeracy, and Margaret knows that I've written about all of this, and I have. So I was very interested to hear that. And you know, my own, I suppose, anxiety would have been educational anxiety. But once I was able to accept that I have a learning disability, going back into education, I just found that, and also one of the other things we did in our learning center was relaxation techniques, like mindfulness and things like that.
Thanks, Mark.
And thank you, Mark. That makes a lot of sense what you said, Mark, and I'm sure a lot of people can agree and relate to what you said. Absolutely.
Yeah. And also, I've written stuff, and I said that already, but if you want me to, if you want to read it, I can share it with you.
Yes, that would be great. Thank you.
Yeah, yeah.
Would anybody else have any questions or comments they'd like to make? You can put up your hand or speak there. I know Claire is happy to continue if we have another little bit of time to talk, but just don't be shy if you would like to ask a question. Move on, yeah? Okay. Will we go back to you again, Claire, if that's all right?
Yes, certainly, Margaret.
Yeah, and certainly over the next little while, if anybody, I'll keep an eye, and if anybody wants to put up their hand or indeed write a comment, we can come back to you then. All right, thanks.
Okay, well, if I can share something that I find very helpful to me and something I use a lot in my work. When Mark described his difficulties, a lot of the people I'm privileged to work with have had similar difficulties. And as I said, they might have thought that they were stupid, or other people thought they were stupid. And they might have got a diagnosis of something like dyslexia. And they might have, some of them have decided that they were dyslexic, or they were stupid, or they were not good enough. So one of the ideas I'm always keen to share is that we are our name. So I am Claire, but everything else is something I have. So I ask people to think, and I'll ask you to think, if you knew somebody who has a disease called diabetes, would you say that that person is a diabetic, or that that person has diabetes? So maybe I just give you a moment to think about that. So if you could just wave a hand, how many of you might think, well, actually, no, most of you have your camera turned off, so that's not going to work. So when I ask that question, a lot of people say, or some people say, well, I would say that person is a diabetic. And then other people might say, I think that person has diabetes. And then other people might say, Claire, there's no difference. I think there's a big difference.
Yeah. Yeah.
A big difference. So if the person is a diabetic, it's like it's on their t-shirt, I am a diabetic, or it's like a badge they're wearing, I am a diabetic, or it's a flag they wave, I am a diabetic. And what happens very quickly is things happen in the family that are seen to be because that child is a diabetic, or that adult is a diabetic. So it's like they think it's their fault. So something simple as meal times might need to be at a certain time. So if children are out playing and the parent says, come on in, it's 5 o'clock or 6 o'clock, you're having your meal now. And the children might say, please let us play for another few minutes. And the parents might say, no, because Johnny or Sally is a diabetic. Or the child might say, please, may I have whatever that is? May I have that yogurt? And the parent might say, no, that's Sally's because Sally is a diabetic. The other way of looking on it is that Sally or Johnny have diabetes. So it's like they've been given a bag to carry. And in the bag that they're carrying is the illness, the disease, diabetes, but it's not them. It's something they have to carry for the rest of their lives. And the doctors and nurses and parents help them carry that. But it's the child's bag, or the person's bag. And why I like that is because then, if you go back to the example of the children playing, can we not play for 5 minutes more? The parent can say no because Johnny or Sally have diabetes. May I have that yogurt, please? No, because that's for Johnny, or that's for Sally because they have diabetes. Johnny or Sally can say, I don't want diabetes, you take it. And the person can go, no, I don't want it. So it's a it. It's not a them. So if we substitute and change the word diabetes for dyslexia, so instead of saying someone is dyslexic, they have reading difficulties. In my view, there's a completely big difference between that. So it's something they have and they can do something about. So I just pass it back over to you, Margaret, in case there's any thoughts or comments or reactions or questions from what I've just said.
That's very interesting because it's quite a subtle difference. It's not, but I can see what you're saying, yeah.
I would say that, well, I say I live with diabetes. I don't say I have it or I am. I just say, because I was diagnosed in around 2011. And my brother, who is, he's professor of endocrinology, the first thing he said to me was, be careful who you say it to, because people who don't know it, people can be fierce, people can be very ignorant if they don't understand. So they just think, well, maybe I gave him some food, but he said that's absolute, that's nonsense. But now I just kind of say, like, I live with diabetes. Like I say, I live with dyscalculia or something, and that's my way around it. I just say, because both of them are manageable, they're not. And I get really mad when I hear people say, oh, dyslexia is an illness. Like, it's like you get up in the morning and you don't. It's, you say you live with it. It's like it's a manageable condition,
Yes.
Is that hard? Yeah.
Yeah, great. Thank you. I can't see the names on screen, so thank you very much.
Yeah.
And if we substitute that word, the dyslexia, for the word depression, same thing applies.
Yeah.
So some people might say they are depressed. And I think there's a big difference between saying someone is depressed and somebody has depression or is feeling down, or, as you just said, Mark, living with something.
Yeah.
Then we can do something about it. And if we think of depression, a big bag that we might be carrying around that might drag us down. And depression can be anger turned inwards. So someone who has depression it might be hard to spot because they might seem as if they're in great form. And Aware's website have lots and lots of resources. And one of the things that they have is a word called festival, F-E-S-T-I-V-A-L. And each of those letters give an idea of some of the symptoms of depression, how people might know they're experiencing depression. So F, for instance, is feeling. So someone might be feeling down, feeling upset, or feeling angry with themselves mostly. E can be energy. So people's mood can be affected, their energy. They can find it very, very difficult to go and do things. S is sleep. And with depression, people might find it difficult to get to sleep because their thoughts can be worrying. They might be worried about what they did or worried about the next day, or they might go to sleep and wake up early. So if you have a look at Aware's website, there's lots of things that you might find useful to do. And there are courses that are free to do called life skills. And these are courses based on cognitive behavioral therapy, CBT. And one is an 8-session course that has been developed by Professor Chris Williams in the UK. And he calls his course Living Life to the Full. Aware calls it Life Skills. And it's an 8-session course that will be offered in person, but over the time of the pandemic, you can do it on Zoom. And then there's that's a 6-session course. And then there's an 8-session course that was developed by Dr. John Shari and his colleagues in Silvercloud. And you can do that on your own, or you can do it with the support of an Aware volunteer. There's more reading in the 8-week course, and the 6-week course have booklets that are very clear. Also, Aware has a phone line, a helpline, a support line that you can phone and speak to someone, a volunteer, and get support. We also have support groups. These are going to become in person again, but at the moment they're still on Zoom. And over the next few weeks, we're delighted to pilot a new program for people who have bipolar disorder, living well with bipolar disorder. Aware also have lots of lectures that they have on video over a number of years. What is depression? What is bipolar disorder? What depression in adolescents, depression in the elderly? anxiety. And in the last week we had a Where's Mental Health Week. So I facilitated 3 webinars, 30 minutes, 35 minutes each. One was on Monday with Stephen McBride, our Wellness Director of Services, looking at what is depression, the nuts and bolts. On Wednesday, I spoke with Dr. Keith Gaynor, who's a clinical psychologist. I'm looking at how can you cope with depression. And Keith was talking about our noisy heads and about kindness and how we are human beings too. And we would treat our friends with kindness. Why don't we treat ourselves with kindness too? And then on Friday, I spoke with 2 people who are supporting Aware's work. They're both volunteers with Aware, and they're ambassadors. They both spoke about their own experiences of depression for many, many years. A lady called Brianna and a man called David. And both of them spoke about how they cope to keep themselves as well as they can. And they both spoke in different ways. David talked about the importance of communication and of doing things he enjoys. Brianna said that sometimes it's too much for her to do something that she enjoys. It's too hard. So she'll break it down and she'll do small tasks, small things.
Claire?
Yes?
Can I just interrupt a small minute? Thomas had a question there. He just put up his hand, I think, if you wouldn't mind.
Right. Not at all, Thomas. Yes, thank you.
I would like to ask the lady, actually, can you tell by a person if they have depression? And can I actually tell you another thing? I hate that word, actually, dyslexia. Is that a part of depression?
You know, I'm with you. I don't like it either. I prefer to think that someone has a difficulty in reading or learning. And when I was a child, we had what was called a slow learner. And I actually like that as a term. People might not like it, but that we can learn, but we can learn a little bit slower. But like any word, it took on a meaning that people didn't like it. But I don't like dyslexia either. And can we tell if someone is experiencing depression? Sometimes, Thomas, we can, and sometimes it's very hard. So how we can is if someone's behavior. Pardon?
Margaret, can you hear me?
Yes, I can hear you too. I can't hear you, Margaret, though.
Sorry, Thomas, we can hear you. Could you speak again just to be sure? Seem to have frozen a little bit there, Thomas. Okay. Yeah, he does seem to be frozen there.
Well, maybe if I answer the question that Thomas asked, Margaret,
yes,
would that be okay?
Perfect.
So how do we recognize, or how do we know if someone else is experiencing depression? Well, sometimes we can't, because person might be putting so much energy into looking as if they're in great form. So they might even seem better than they usually are. But also, we might notice by what they do. So they might be snappy. They might not be as well dressed. They might not have washed their hair or their clothes. They might not have energy. They might be tired all the time. And they might be talking about life in a very harsh way, and mostly about themselves. They might be saying they're useless, or they're not good enough, or there's no point in doing something. So it can be very, very difficult sometimes, and then sometimes it can be very easy actually to spot. And then the question next is, well, what do we do? So it might be helpful to say to someone, I'm just wondering how you're doing. Just wondering, would you like to talk to me? I'm just wondering, would it be helpful for you to have a chat with someone? And your GP is someone you can trust. And we always encourage people, if they're experiencing depression or think they might be, to talk to their GPs. Absolutely. And that explains really why it's so important for us to help ourselves if we're experiencing depression, and other people as well. And there is help there. And sometimes people think that there is no point, and they really might think they're better off dead. And people can get very frightened by those thoughts. And some people can think that they're suicidal and can think about harming themselves. So I'm really keen to emphasize that they're thoughts. And they're, in my view, talking about language again, there is no such thing as anyone feeling suicidal. They're thoughts. People can have those thoughts and they can feel worried or frightened or upset or shocked, or some people might feel relieved. But just because people think they're suicidal or think they're better off dead does not mean they have to harm themselves. There are always, always options. And what's not known enough is how dangerous alcohol is. A lot of people have died in the past, not because they were suicidal, but because they had alcohol in their system. So in terms of keeping well and managing our well-being, it's balancing what we're thinking, our thoughts, what we believe, being kind to ourselves for how we feel, and really focusing on acting in a helpful way. And Mark, you mentioned there was no counseling years ago, and you know, I completely agree with you, but there is a danger in us doing anything too much. So if we eat too much, it's not good, or if we run too much. Brianna, the lady who spoke on a Where's webinar on Friday, spoke about her experiences of therapy in America from the age of 9 when her father died. And she's spoken publicly about this, so I can mention it. And then she mentioned when she was in her 20s, meeting a psychologist who suggested to her that she might not need to have therapy on a regular basis for the rest of her life. And I thought that was very helpful. So yes, it's really important to get support, but we're all very strong ourselves. And there's a word called resilient. And we develop resilience, and you might agree with me on this, Mark. We develop resilience through difficult circumstances that we had as children and as teenagers and as young adults. And we learn to keep going. And we might surprise ourselves by how strong we are. Like 2 years ago, who would have thought that we would have been able for everything that we've had through COVID-19? And we have.
Thomas got cut off there a little minute ago, Claire, but he's back now. And if I don't see any other hands up, and I think it might be nice to come back to Thomas if we could.
I'm sorry I lost the signal to you, but my questions actually was, would you know by looking at a person whether they had depression? And as I was telling you, I hate the word dyslexia. For the past couple of years, actually, I hate it because I am a dyslexia person, and I get angry when it all depends on what way the person actually comes across to me with that word.
Yes. And Thomas, you might not have heard my answer to both of those. I don't like the word either. And that's why I would say it's something that someone has, but even they might find it more difficult to read rather than saying they are dyslexic. And then your second question, sometimes it's easier to know if someone else is experiencing depression, and we might know it by what they're doing. So they might be sleeping a lot, they might be withdrawing from other people, they might be very cranky, their mood might not be in good form. But equally, we might find it very difficult to know because they might be deliberately hiding how they're feeling, and they might be pretending to everyone else that they're doing really well. So it can be easy to spot in some people, and it can be very difficult in others.
Yes. Can I ask you, is it true though that you have to get medication for depression?
Well, I'm not a medical doctor, so I can't comment on medication, but my understanding of depression is it's been called the common cold of psychiatry. So anyone can experience depression, and without any help, they come out of it. But if they need extra, if their mood is very, very low, medication can help to give them a lift. The important thing is to do it under medical advice and to come off medication under medical advice. But medication on its own might not help someone develop the skills to keep themselves well. So medication, if it's needed, and it's not needed for everybody, but medication, if it's needed, and cognitive behavioral therapy or some other way of helping getting psychological support can teach people the skills. So it's like if we get a bad burn, yes, our skin will heal, but it might take a long, long, long time to heal. And if we're pulling at it and we're picking at it and we're pouring hot oil on or boiling water, it's going to take longer. But if we get a burn and we're gentle to ourselves, and instead of blaming ourselves, why did I do this? If we say, okay, my hand is sore, and we get something, some treatment, and we go to the doctor if it's very bad, or we get some burn lotion and we're very gentle with it, and we don't go pulling at it, and we don't pour other hot things on it, our wound will heal a lot quicker. So with depression, it will ease eventually, but there's a lot of support there that can be done to help people.
Can I ask you a question about mental health? Actually, I've been listening to about mental health for I don't know how long. Now, maybe it's because I'm an ignorant person that I don't know what really mental health actually is. But can I actually tell you, I've heard two people on television, one last night and the night before last, and there were two footballers, and they were talking about their mental health being, or whatever you like to actually call it. And I says, if those people are trying to tell me that that's what they call mental health problems, I wouldn't like to have them have water of what I actually have been. And
Sure.
is it a showpiece that those two people has been on television talking about mental health? You're the qualified person, and that's the reason I'm asking you them questions.
Yeah. Look, it's a really important question, Thomas. And when you said you described yourself as I am, so that's like me asking a question and thinking I'm stupid because I'm asking it. You're not ignorant, okay? And this is, you have a question that's important. There's a lot of confusion about mental health. I didn't see those two programs, but some people who have experienced depression or anxiety have become, and if they're well known, they have become public to talk about their experiences to help other people know that it's okay to talk about it too. But we each have different experiences. And I think if you were to talk to anybody in the country, they could talk about their experiences of challenges, of difficulties, of sadness, of upsets. And somehow that's part of life and we get on with it. But if people are stuck and they're not able to get on with it, or there's nobody to help them, or they're not able to take the help, they might be focused more on how bad they're feeling. They might compare themselves to others and think they're not good enough. And they might do things to make themselves feel better, which actually make them worse, like drinking alcohol, or taking loads of coffee, or isolating themselves. So what is mental health? I see it as health. Physical health and our mental health, to me, are all the one. If someone stands on my toe and I immediately think, how dare they? And I feel really angry and I bottle that up and then I blame them and I think everybody else is terrible. Well, that's not going to help me be a well human being. If someone stands on my toe and I go, ouch, that was sore, and the person says, I'm sorry, and I said, that's okay, and I forgive them, or I understand, and I don't put my toe under their foot again, I learn from it, that can help me to become a well human being. So life gives us opportunities every single day, billion times a day, and we can blame ourselves, or we can blame other people, or we can go the ABC. A, I feel upset because I think that wasn't nice, but I choose to learn from this, but I choose to be kind to myself. So I hope that answers your question, Thomas. And I'm just conscious, Margaret, it's gone past the time. So I don't know how much more, just to let you know. I could keep
thank you very much, Claire. I think Thomas's question is a really poignant one as well. You know, it's hard to hear somebody who looks very maybe successful, you know, like expressing their perhaps that they have mental health issues, when you think, oh, sure, they're totally successful, you know. But I suppose it's also, you know, you really don't know what's happened with somebody in the past, and you might know all the horrors that you've been through, which make you, you know, feel a certain way about yourself and how you struggled. But it is hard to compare one person to another, and I suppose it's a big question that and it can look then as if they're being light and just being topical, but actually I suppose none of us are in the shoes exactly of the other person, and we don't quite know what they may have been through, and what it meant for them to step into where they are now, or to be able to speak about it. But it is a very good question. Claire, I would like to thank you for, I think you've covered quite a bit, you know, in a short time. It is a short time to be discussing something so, which can be very personal for people, and which is quite a deep topic. And I do appreciate the tips you've given, and the effort, you know, to communicate so well with people, and I thank you for that. And I suppose just to remind people that there is help on the Aware website, and in particular for depression and bipolar disorders and some other struggles people may have. So I'd point people to that information. And just thank you again on behalf of all the participants here today at our first webinar. So thank you very much, Claire. I don't know if there's anything, I'll just do it. I'll look at the gallery just in case anybody has anything they want to add or share in the chat. Somebody left with their class, was finishing up, and they said, thank you very much for a very thought-provoking session. So thanks for that. I don't see anything else, so I'm happy enough to leave it there. All right, everybody, and I wish you all well. And thanks again, Claire. Much appreciated.
Margaret. Thank you. And I wish you all a good
Bye-bye.
Thank you.
Thank you. Bye-bye.
Bye.